Health and Human Services Secretary Robert F. Kennedy Jr. testified before the Senate Finance Committee Thursday, where he unapologetically defended his approach to health care and his restructuring of the nation's health agencies. Before the hearing even started, Democratic lawmakers, health organizations, and current and former HHS employees called for Kennedy to resign or be fired.
It is in the country's best interest that Robert Kennedy step down, and if he doesn't, Donald Trump should fire him before more people are hurt by his reckless disregard for science and the truth.
Just in the last month, Secretary Kennedy has fired CDC Director Susan Monterez and canceled $500 million in funding to help develop vaccines using mRNA, which is how the COVID vaccine was created in record time. Kennedy also revoked the emergency use authorization for the COVID-19 vaccine, which evidence presented at the hearing shows is confusing doctors about who should get it. Secretary Kennedy said all these moves are important steps to restore public trust in healthcare.
CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And that's why we need bold, competent, and creative new leadership at CDC.
In June, Kennedy removed and replaced every member of the Advisory Committee for Immunization Practices, or ACIP, which makes recommendations to the CDC about the safety, efficacy, and clinical need for vaccines. Critics say Kennedy's appointees have a history of questioning vaccines that have been proven effective. The new members will meet for the first time on September 18th and 19th. There's bipartisan concern that some of these members could try to revoke vaccine guidance that has been proven to work.
I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense.
Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening?
Some of the vaccines that could be discussed at the ACIP meeting include measles, mumps, and rubella, and hepatitis B.
There are real concerns that safe, proven vaccines like measles, like hepatitis B and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, that the public trust can be lost.
Kennedy said he doesn't expect any changes to the MMR vaccine, which babies and children get in 2 doses. He also said it's wrong to say he's denying people vaccines. In addition to Kennedy's new approach to vaccine safety, senators also took issue with him openly casting doubt on government data.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC.
The criticism doesn't appear to have changed Kennedy's mind. In fact, right after the hearing was over, HHS announced it is reinforcing religious and conscience exemptions for vaccine mandates for children. I'm Ray Bogan for Straight Arrow News. For more unbiased reporting straight from our nation's capital, download the SAN app.